Good afternoon, everybody. I want to invite you all for another YouTube presentation on a neurological topic today. The topic is primarily on brain tumors. Brain tumors are unfortunately a common condition that we encounter fairly frequently because of the several types. The most common symptoms that patients first have when they have a symptom of a brain tumor is headache, sometimes dizziness, sometimes a sense of fogginess, difficulty with focusing, concentration, and also sometimes difficulty with performing higher calculations. Patients have difficulty with performing things like balancing a checkbook, calculating numbers, and things like even driving. Sometimes they find that they forget which side to turn on the road, etc. If they're planning on turning a right turn or a left turn, they get confused. And also they sometimes get confused on things that they do every day. So if they were to drive to their office every day by the same pathway, they might make a mistake on the road that they took. And those are all telltale signs with possible brain tumor if there are signs of headache, dizziness, nausea, and even vomiting if that's present for an uncontrolled and a reason that is not related to any stomach issues, then one must evaluate for a potential brain issue like a brain tumor. Brain tumors are of two basic types. Brain tumors are of primary and metastatic brain tumors. These are the malignant types of brain tumors. There are brain tumors that are benign. I'm going to start first with the malignant brain tumors because those are the ones that are more scary. The brain tumors that are malignant are either primary brain tumors, that means that they arise out of the brain, and the metastatic brain tumors are the ones that arise from another part of the body and go to the brain. Let me first start with the primary brain tumors. Primary brain tumors can either be in the top of the brain, or the middle area of the brain, or the back of the brain. Back of the brain tumors, I'll start from the bottom up. For the back of the brain tumors, those are usually tumors that are surrounding the spinal cord and the brain stem. Brain stem is the area that is around the back of the brain. That area of the brain causes difficulty with focusing, concentration, sometimes nausea. If it's severe enough, it causes vomiting. Those brain tumors can come of several types. Brain tumors that are infiltrative inside the brainstem or the back of the brain, or the brain tumors that are encapsulated. If they're encapsulated, that means they're like a pimple inside the brainstem. They can be easily taken out and have a relatively better prognosis. If they're infiltrated inside the brainstem, like tentacles in the brainstem, that prognosis is not so good. That has to have substantial amount of treatment, such as chemotherapy, radiation therapy, possibly multiple levels of surgery. With regards to the brain tumors in the top of the brain, those are also of several types. Those can be vascular brain tumors, where the artery and the vein connect. Those are called arterial venous malformations. So when the artery and the vein connect inside the brain, they can cause like a golf ball-like structure, which is very vascular, full of blood supply, and it's very dangerous to remove that easily. You have to sometimes clot off blood vessels that feed into that area and then remove it. And that's called a arteriovenous malformation. It looks like a brain tumor inside the brain, but it's actually an artery and vein connected. Those are blood vessel related brain tumors. There's another type of brain tumor that is infiltrated brain tumors inside the brain. Those infiltrated brain tumors are the ones that are like octopuses or tentacles that go right into the brain. And those are very dangerous, have a very poor prognosis. The most common one of that type is called glioblastoma multiforme. You've probably heard of some famous people in the past. John McCain, Senator, the United States Senate from Arizona, Ted Kennedy. All of these people had the same type of brain tumor, glioblastoma multiforme. Unfortunately, after a couple of years of aggressive treatment, that is with brain surgery, chemotherapy, radiation therapy, immunotherapy, the outcome was not great. They still ended up having to succumb to the illness. That tumor, glioblastoma multiforme, is an unfortunate tumor that has a very high mortality or death rate. With regards to other types of brain tumors, these are the ones that are more encapsulated. They are malignant. They continue to grow. By virtue of malignancy means they can continue to grow and continue to cause symptoms. Those are encapsulated brain tumors in other areas of the top of the brain. They have a better prognosis than glioblastoma multiforme. They can be treated surgically first to remove the bulk of the tumor, and then later, if need be, depending on the cytology or the pathology of the tumor, they can have chemo or radiation therapy. These are in a synopsis the primary brain tumors of the top of the brain and back of the brain. The metastatic brain tumors are a little more serious. Once a tumor from another part of the body, such as a breast or a lung or an abdominal tumor, has spread to the brain, that means it's already gone throughout your blood vessel circulation and seeded many areas. Prognosis is not great with those. Most commonly, we see that kind of a tumor in the brain from breast cancer and from lung cancer. Lymphomas can also cause that rarely, but not as common as breast and lung cancer. When a tumor like that is found, it has a particular finding on an MRI. It's usually not one isolated area that is involved, it has multiple areas that is involved. It looks like snowflakes that are present inside the brain, affecting the brain. And those are usually a telltale sign on an MRI that the brain tumor that we're actually seeing is coming from some other area of the body, and we must search for those areas of the body to find primary tumor site. With regards to benign brain tumors are present. They have usually a good prognosis because they can be removed. The most common one is called meningioma. Meningioma is a ball of calcium which basically sits inside the brain, and it causes compressive symptoms. So if it's a small ball of calcium about 3 or 4 millimeters in size or less than a centimeter in size, it probably may not cause any significant compression. It may only cause some symptoms of headache, and we monitor those to see if it grows. Many times they don't grow. If it turns out from the day one it's a larger tumor of a meningioma type, a couple of centimeters in size, then it's probably worthwhile getting that removed because it ends up being a cure. Brain tumors that are benign inside the brain are either cysts inside the brain or calcium deposits like meningiomas are the most common ones. And these, if they're small, can be monitored and usually have a very good prognosis. The important issue that we all must keep in mind is that if you have a new onset symptom of headache, dizziness, sometimes nausea, sometimes some memory complaints, cognitive complaints, difficulty focusing, concentration, etc., then it's worthwhile looking deeper into what is the cause. And it's appropriate to get a medical and possibly a neurological consultation depending on what your primary care physician says. And such a consultation, if it is followed through with, then it is appropriate to consider the evaluation. The evaluation that is commonly done is a routine MRI of the brain to make sure that there's no signs of a brain tumor or an aneurysm or any cysts or any benign tumors. And if that's not the case, then one can treat it as a symptomatic headache rather than an underlying headache from an underlying brain tumor. So to give you a synopsis of what we discussed, brain tumors are divided into primary brain tumors of the brain, which are divided into brain tumors of the top of the brain tumors of the bottom of the brain. Then there's secondary brain tumors, which are brain tumors that are metastatic from other parts of the body, like from the lung, breast, etc., that go into the brain. Those are more dangerous because once they hit the brain, they will hit the general circulation of your body. The third type is benign brain tumors. These are calcium deposits in the brain that are causing pressure-like symptoms. Those are less of a issue there. They have a very good success rate with treatment, and the treatment usually is surgical if the size of the tumor is beyond a certain level. Usually about 1 centimeter or more, then we look at it more carefully. And the most important thing that you should keep in mind is that if you have a new onset headache, please go to your primary care physician discuss this with them and see if their exam is normal. And if they feel that there's some suspicious aspects of the medical and neurological exam that they find, then it's worth further pursuing it with a neurological exam and an MRI of the brain to make sure. If any further questions, please post on our YouTube site and we'll be happy to answer them. Thank you very much.